So that's the vegan salmon patties plated up, and I'm having carrot chai without almond milk, and this is James's plate of them. And I'll talk a minute about the movie and then get back into talking about the book that I've been reviewing over the past little while. So, if you cook these vegan salmon patties, there's no salmon in them, they're vegan. They're just orangey color because of the carrot pulp. And in this batch I made with pumpkin pulp also, so they're not as orange as they normally would be. Because normally it would just be carrot pulp. But anyway, with some yellow fleshed potatoes to stick it together, which it doesn't take much to hold pulp patties together. Anyway, so I didn't put any fat in the patties themselves. They're a prebiotic patty, so if you have them with probiotic, or I had a quarter cup of kimchi this morning, so I think I'm fine. Then that's best. And I put on some, so if you cook them with just a little bit of oil or none, these ones I pan fried, but you can bake them if you want to have no oil at all, or if you really like fat, then you can deep fry them in some coconut oil or ghee or something. Anyway, that's to your taste, right? But the thing I like is cooking without oil, and then you just take whatever like fat you want to eat and then just drizzle it on afterwards. So then you know I had about a teaspoon there, and James can put on however much he thinks he would like with his meal. And that way, if you're trying to watch how many calories you're eating, and James had more than I had, quite a bit, but he likes the fat more than I do, and he can handle it better than I can. I can't handle it. So anyway, so that's that. That's what I would recommend is learn how to cook without fat, and then put it on afterwards.
Did you know we have a studio audience, not just an audience on the internet? Look on the purple chairs up there.
Where?
By the barbecue pit.
Oh. Yeah, he looked at you.
A little bit of a distraction. It was looking over.
Yeah.
There's a cat looking quite cute over there on one of the purple chairs.
Well, he used to be really scruffy. Somebody dropped him off, and he looked like he was on his last legs. I was scared that everything in the neighborhood was going to catch diseases off him.
But now he's looking up.
But the neighbor's been caring for him, and
quite a handsome-looking cat, really.
Yeah, I don't know. They took him in for some vet work, I think. Yeah. I think that's what did it initially, and then and now he looks like a pretty good cat. I don't know if he'd ever be house trained.
I don't think so. Anyway, decided to try a couple other chairs. Now it's sniffing something.
Now he's sniffing around. Yep. Well, anyway, so
it got bored. You know, like it was interested in the food.
Okay, I better take a bite of this patty just to taste, because I gave away 2 tubs full. Each had 40 of this size. This morning, we'll see if they're going to be saying, "Oh, those are terrible." They probably will.
What do you think?
I think they're good. They could use more spice for my taste. What do you think? You taste.
They're both right.
Okay.
You like spice, but they're definitely not spicy. So.
And I could have put that whole package of wakame in, no problem, rather than only putting half. But when giving to other people, I'm a little bit shy about my use of wakame, or any of the seaweeds, honestly. It's okay.
Yeah, it's plenty good. It'd be good, like maybe with a little sauce on it, but I say,
well, I recommend
it's better to have it done, like where See, one thing that I could have put on is that seafood sauce.
The tartar sauce. Yeah, that's what I recommended people eat
Is that
with
what
it.
that is?
Oh, no, you mean that shrimp sauce.
Sure, shrimp sauce.
Oh.
Yeah. I think they called it seafood sauce. But
Oh, I
anyway,
don't know.
definitely not tartar sauce. I'm not a big fan of that. So other stuff is basically horseradish with the tomato paste, but it's kind of a lot better than horseradish. That's the stuff that people usually eat on shrimp red stuff.
I don't know. Anyway, this movie. Do you want to talk about the movie, James?
Trick or Treat. What is it called?
I think that's what it was called.
Okay. Yeah, it was fairly good as far as these things go. It's kind of campy, kind of disturbing. Was there a lot of gore? I guess there was. You know, when you see this genre after a while. The thing that I found cute, I think you found cute. It had, what was the name of that woman?
Sookie? I don't know what her real name is, but
yeah.
Sookie from True Blood.
She does a good job in this one.
She did.
She's playing a slightly different character in True Blood, but not that much different. I think this is how she got into True Blood.
Yeah, that's my favorite part too, is the part that Sookie played.
Yeah.
Very cute.
I wouldn't have recognized her, but you're better at this sort of stuff than I am. Oh, and we won't say why it's this particular movie, because they're.
But it is worth watching if you like watching horror movies. You know, they keep. When I was a young adult, I thought, why in the world do they mix comedy and horror? It just seems wrong, you know, to make light of such things. And then I realized, wait a minute, that's why they do it. You know, because these kind of topics are kind of hard to handle, and you want to show the audience this is not real. Don't get too serious about this. It's, you know, this is real stuff. So now that's how I like it. I like the horror movie that's jokey.
The jokier are the better. That's why. What is his name? Campbell, Bruce Campbell, is the master of the genre.
Oh, he's so good.
I think he's a university guy. Got together with some buddies, and he just had the best of this campy kind of ironic humor that comes with being a university student.
I am not enjoying the leaks overly much.
Oh well.
But I was very thankful because we had tarragon given to us today. Very good. So it goes with the flavor of the salmon patties because tarragon goes well with fish. Anyway.
You're going to talk about Lyme disease?
Which
is a real horror story.
It is a real horror story. Although I'm sure there's a lot of people that believe it's just a joke.
That was good. You improvised that. That's very well done. Good.
So,
you took my segue, which I thought was pretty good.
Yeah.
And you really ran with it. You know? Yeah, you're running like Ben Johnson back in the day. Anyway.
So, apparently there's crushing fatigue, exhaustion with this. There's a quote in here from a woman. I used to be a cross-country runner for my high school. Now I'm lucky if I can go from the couch to the bathroom without getting winded. 22-year-old college student.
Cross-house crawler.
Yeah.
Cross.
So she used to be a serious athlete.
I can relate to that.
Oh, I know, it's hard for you because you used to be amazing. There's
10-mile
like
races, half marathons, mile races.
But yet, cancer chewing away at your bones, that really takes a lot out.
Just using the walker to go to the washroom and lying down there.
Yeah,
that's the way it was 8.5 years ago.
Shortness of breath, air hunger, winded going upstairs. No, I should mention I'm on page 49 now. Drenching night sweats, temperature regulation issues, myalgia, persistent muscle soreness, headaches, weight gain, pathogenesis. I don't know what that is.
Well, that's kind of weird. Path would be like pain. Big genesis would be be like the beginning of it. I don't know what it means when it's put together.
Immunologically, TNF alpha, tumor necrosis factor alpha, along with other cytokines, activate macrophages to produce nitric oxide that kills intracellular parasites. Pulmonary
Embolism?
maybe inflammation, or I'd abbreviated, I don't know, is the most common complication it'd probably be pulmonary inflammatory disease or something. It's the most common complication of those with severe B. microti infection. Others show non-cardiac pulmonary edema. Immune-compromised asplenic patients have the worst outcomes, brought about by low CD4 T-cell activation that can lead to fulminating and persistent parasites with eventual death. Like borreliosis, a negative test does not rule out an active infection. 52.
Are you taking notes, doctors?
He treats with a combo of medications for at least 6 months. Hyperbaric, O2, ozone infusions, blood replacement with red cell transfusion. Hope McIntyre MD wrote, Babiosis causes false positive Lyme testing by producing cross-reactive antibodies due to activation of B cells. Most babiosis is resistant to the standard treatment of Mepron and Zithromax. Babiosis antibodies don't develop until after the patient has cleared the infection. The sicker the patient, the fewer the antibodies they will make. Once the infection is cleared, the antibody titers will rise, ironically providing proof that the patient has had the disease. 7 venous blood is used. I don't know what I was writing there. The slide needs to be viewed within an hour. If venous blood is used, the slide needs to be viewed within an hour of the blood draw. Otherwise, the morphology changes and the parasites will not be seen. Babiosis is a public health crisis. Blood donor. Babiosis is the underlying cause of many serious chronic diseases: ALS, Alzheimer's, dementia, aneurysms, anxiety disorders, autism, bipolar disorder, chronic fatigue syndrome, depression, ITP, inflammatory bowel disease, failing memory, neurocognitive disability, food sensitivities, and interstitial cystitis. 53. Rickettsia, Rocky Mountain spotted fever. Once a tick is infected, it is infected for life. An infected male tick can transmit the bacteria to an uninfected male, who can transmit the infection to offspring. Trans-ovarian passage. Mammals can get it by eating tick feces or getting it in a wound, getting the feces in a wound. It can undergo parthogenesis. Petechial rash, pinhead, brown, or red spots, but 10% of those infected don't develop a rash. Antibodies detectable 7 to 10 days after the illness begins. Start treating immediately. If started too late, serious complications can occur in cardiovascular, respiratory, CNS, gut, and renal systems, which can lead to death. 56. Anaplasmosis invades white cells, granulocytes, bone marrow, and endothelial cells. The organism routes essential nutrients to the host organelle, vacuole. The bacterium stabilizes its own outer membrane by incorporating cholesterol taken from its mammalian host. The dependence on cholesterol indicates that patients, especially older patients with hypercholesterolemia, may experience more infections. A low cholesterol diet may be helpful in controlling the infection. Paleo nutritional protocol is highly recommended. I don't know if I agree with this here, because if you're looking for a low cholesterol diet, paleo's not low cholesterol. So, anyway, lowered white cell count, elevated liver enzymes, mild anemia, and thrombocytopenia, lowered platelet count, doxycycline, azithromycin, and Ceftin are especially effective. With low white cell count, one has to be aware of the possibility of viral transmission. Borrelia burgdorferi can enter tissue cells, including white blood cells, and be protected from antibody immune detection. Produce and shift to biofilm colonies, cluster of bacteria surrounded by immunologically impermeable matrix. They can change to persisters and are protected from immune system detection. Metamorphose into a cystic form. This protective cyst is immune impenetrable and remains dormant in the patients for long periods of time. These cyst forms are capable of regenerating a new generation of spiral motile spirochetes. Metamorphose into cell wall deficient forms, thus evading immune detection. Lyme is a clinical diagnosis. 71. On average, it takes patients seeing 5 to 10 different doctors from multiple specialties to obtain a proper diagnosis. 100. It's page 100 now. The Borrelia bacteria binds human plasminogen to surface proteins. It's then converted to plasmin to provide the mechanism where it can digest the extracellular matrix and penetrate cell walls using the host's own enzymes. Brain microvascular endothelial cells are essential to the blood-brain barrier due to their high electric resistance. Borrelia can traverse this barrier due to their high electric resistance. Plasminogen leads to breakdown or blood-brain barriers. Breakdown of it. So, B. burgdorferi can invade the central nervous system. Once inside, it can survive in cytoplasm, safe from immune detection. B. burgdorferi can exist within migrating macrophages or immune cells. This provides a possible means for recurrent borreliosis. 101. The organism can change surface antigens, protein on outer coat, and alter the lipoproteins within its cytoplasm. B. burgdorferi appears to metamorphose from an active motile spiral flagellar form to a dormant resting cystic form, particularly in the CSF, cerebrospinal fluid. It can then reverse itself from the dormant cystic form back to the active motile form, producing a new generation of spirochete bacteria without a brief infection from a tick bite. Present testing methods are unable to detect the presence of the bacteria in the CSF, cerebrospinal fluid. Besides electron microscopy, I put question mark because how did they see them if present testing methods are detected? You know what I mean. Anyway, elegant photomicroscopy found the bacterium can penetrate a T or B cell lymphocyte and camouflage itself within the cytoplasmic contents. Untreated borreliosis in most cases will become a chronic spirochetal infection following the examples of other bacteria of the same genus, syphilis, relapsing fever, and leptospirosis. The mature B. burgdorferi bacterium exhibits intracellular and changes to a cystic self-wall deficient phase or non-motile spherical starvation stress form when host environment becomes hostile, low source of fatty acids and lipids. Again, paleo, high-fat diet. So, anyway, in this state, the bacterium can persist and evade immunologic protection. Under times of physical or psychological stress for the patient, the bacterium can produce a new generation of spirochetes. They metamorphose back from the cell wall deficient form back to the mature spiral form. If the live B. burgdorferi is and its plasmid structure fragment glandular protein persists in the body, it will continue to cause tissue injury in the patient. 102. The Borrelia bacterium promotes inflammation by stimulating endothelial cells, cell walls of capillaries, to cause white cells, leukocytes, to adhere to them and make IL-8 attracts neutrophils, which causes persistent inflammation, vasculitis. Chronic debilitating neurological deficits may take years to develop. This chronic persistent infection may cause an autoimmune type reaction, immune cascade with release of lymphocyte cytokines and interleukin 2-16. I don't know what that is. The CNS is particularly susceptible to this. Encephalopathy. Multiple sclerosis or systemic lupus have been suspected of being the result of an underlying Borrelia infection. 104. Ticks transmit infectious agents that cause Lyme, human babiosis, and aplasmosis, tick-borne encephalitis, and other diseases. These organisms work together to form a complex chronic illness affecting every organ in the body. 105. Why Can't I Get Better? Solving the Mystery of Lyme and Chronic Disease by Richard Horowitz offers treatment protocols. Dr. Joseph, that was the name of a book, Dr. Joseph Burrascano's guidelines have been posted freely on the internet since 1985. 107. Doctors often fear that by expressing uncertainty they will project ignorance to patients and colleagues, so they internalize it and mask it. That was a quote. 108. The treatment of TBD is much more than just antibiotic or antiparasitic use alone. Medication for insomnia, medication for nutraceuticals, for pain relief or neuropsychiatric difficulties, depression, anxiety, neurocognitive difficulties, ADD, ADHD, endocrine problems, thyroid, adrenal, arthritis, muscular spasms with trigger points, fibromyalgia, weight problems, yeast overgrowth, dietary restrictions, nutritional supplementation, for immune support. And that's a quote. And I'll stop here in my notes and get back to this, but I just wanted to mention that I think this is why James does not agree with me, but I think this is a lot of the reason why Lyme disease wasn't taken seriously by doctors for so long, because it's if you don't treat the Lyme disease, then you get to keep administering anti-anxiety medication or pain medication for the arthritis or whatever, and it's something that you just keep going back into the doctor's office for. You keep needing their help, and they keep getting paid, and all they have to do is just easy write prescription.
So these sorts of things do happen. I used to be able to see from this deck tree that was treated by so-called professionals, and what they did was topped it, and topping a tree means that you got to come back and take care of the shoots that what is the technical term for the shoots that come out top the tree? Anyway, it doesn't matter. It's de rigueur amongst the professionals. What was that?
I should know that, but
Yeah,
I
it doesn't
remember
matter.
water spouts are on the trunk.
Yeah.
Suckers are on the bottom.
Yeah. And then they call it witch's broom or sometimes.
I don't remember.
But well, that's non-technical term,
right
witch's
now.
broom, right? So sorry for putting you on the spot like that.
Witch's
but
broom is a disease.
okay, so it's not that. At any rate, it's just something that they pretty well all do. I'm waiting to see one that doesn't do it, one of these professional companies. So these sorts of things happen, like where they don't treat something properly, and end up having to be beholden to them for the rest of, well, in this case, the tree's life, or in the case of what Pauline was talking about, the person's life. So I don't think doctors are that smart, but I think they're some of them are nasty enough to be that way if they actually figure it out.
And I think there's a lot of people who actually want to do well and everything, but right now the protocol is hit it with a lot of antibiotics for a long time, and we're in a post-antibiotic era now. So our antibiotics that we have are very quickly becoming useless, and so what can you do? Are you going to really administer a whole bunch of, when you see there's a huge problem all of a sudden with Lyme, because frankly it should have been dealt with a long time ago. What do you do now? You can't be giving huge antibiotics to everyone. But I'm going to talk about that a little more later on too.
At a different time.